All right, class. This week we will be having a guest lecture who's going to be talking about public health communication. And then after Thanksgiving, Chad Bruckman's going to come to the class and talk about his work in the Tennessee Northeast Regional Office and the work that he does in Northeast Tennessee around emergency preparedness and emergency management. So this is really just kind of your more foundational lecture on public health preparedness. I cannot claim that I'll be anywhere near as interesting as Mr. Bruckman, so once I have that lecture available, I will post it to YouTube so you all can watch that as well. So the learning objectives that are covered this week, which is the last week of lecture for the course, include both the public health communication and information piece as well as preparedness. And Dr. Mike Smith is going to be talking to us about public health communication and how that communication and information relates to the work we do in public health. So that will be available via YouTube, but that'll be the integrity lecture turned into YouTube. So this is just, again, going to be on preparedness. So there's a couple different definitions that I think are going to be important just to kind of get us all thinking around the same idea. So a disaster is an ecological disruption of a severity and magnitude resulting in death, injury, illness, and or destruction of property that cannot be efficiently managed by routine procedures. And every year that I teach this course, due to just the dynamic environment, there is some sort of disaster that occurred. This year is no different, with 3 hurricanes that have impacted 3 major areas of our country, including Texas, Florida, and Puerto Rico. Hazards are the probability of the occurrence of a disaster caused by a natural phenomena. And then incidents are events that are either natural or man-made, requiring a response to protect life or property. So there are two ways we kind of define a disaster, either natural or man-made. And the quiz this week asked which happened more, natural or man-made. And more people are impacted by natural disasters than man-made. So natural disasters are rapid onset phenomena that have profound effects: earthquakes, floods, tropical cyclones, tornadoes, all of the above. Man-made disasters are events not caused by natural hazards, but are technological. So chemical spills, fires, explosions, airplane crashes. So as I mentioned, a massive number of people are at risk for 3 classes of natural disasters: flood, earthquake, and hurricanes. Over 6,000 communities are located in floodplains that have been highly developed as living and working environments. At least 70 million people face significant risk of death or injury from earthquakes because they live in the 39 states that are seismically active. And then 1/3 of the U.S. population live in coastal areas of the United States. And we include coastal as the Great Lakes as well, because those are large enough bodies of water that have significant natural disasters happen in that area. So, as I mentioned, natural disasters, we are more at risk of these than of man-made. So I think for for Americans, the most devastating and shocking man-made disaster occurred on September 11th, 2001, with the Trade Center, the collapse of the Trade Center in New York, and the attack on the Pentagon. And these were terrorist attacks. Over 2,600 people died in the World Trade Center. 125 died in the Pentagon, and over 250 died on the 4 airplanes that were involved in the coordinated attack. And since then, we have had other man-made disasters and attacks, some as recent as a few months ago with the attack in Las Vegas. So, and there's just another list of the 1992 civil arrests in LA, or the LA riots, as you may have heard them commonly called. And this unrest created disaster with over 50 deaths, over 2,000 injuries, and destruction or closure of 15 county health centers, lots of pharmacies, and medical and dental offices. So man-made can kind of capture quite a few different kinds of non-natural disasters. So what is preparedness? This show, I don't even know if this is still on, but there's all this talk about prepping and preppers. And so preparedness is really just the fact of being ready for something, the state of being prepared. And when we talk about preparedness, it is very complex and has multiple players. It crosses multiple jurisdictions and has multiple risks, or it has to be able to be prepared. That's not a good word to use for preparedness. Be ready for a gambit of different hazards. It has multiple laws and regulations, and it can get very messy. So in 2011, past President Obama signed the Presidential Policy Directive 8. And this was the National Preparedness Directive. And it stated that actions taken to plan, organize, equip, train, and exercise to build and sustain the capabilities necessary to prevent, protect against, mitigate the effects of, respond to, and recover from threats that pose the greatest risk to the security of the nation. So then this is just preparedness in general. But the National Health Security Strategy has two main goals. The first is to build community resilience, and then the second is to strengthen and sustain health and emergency response. And so to achieve these goals, there are 10 objectives, and I won't read these all to you, but they are important for us to think about when we think about the complexity of preparedness. And so we can see that to achieve these two goals of building resiliency in communities and strengthening and sustaining health and emergency response systems, that these strategic objectives need to be met to achieve those. And so this is health security. But the CDC, so you kind of go down another level within the executive branch to the CDC, which is housed in the Department of Health and Human Services, as you all would know. This is the Public Health Preparedness and Response Strategic Plan. This also came out in September or in 2011, and there are no goals per se for this, but there are 8 objectives. And they are to prevent and mitigate threats to the public health. Again, you see resilient individuals and communities, because a lot of these disasters are things that we can prepare for as much as we can, but if a tornado is coming and there's not anything we can do to really stop it, right? But what's going to be important is what communities can do to respond afterwards. And communities that have built their own resiliency are going to fare better in that aftermath phase. We've seen the differences in communities that have been impacted by the hurricanes this year, and just the difference in where the hurricanes hit and how the communities have been able to bounce back or not, and what kind of resiliency we're seeing in individuals. And I think in each of the 3 cases, we're seeing some people and communities be very resilient with what they have. So we need to strengthen the public health preparedness and response infrastructure. So after 9/11, we realized there was major deficiencies in our preparedness as a country. So a lot of funding went into building up the infrastructure of public health around emergency preparedness. And that is still a very important aspect of public health practice to this day, because we continue to have to evolve those plans as we face new and emerging issues. So the CDC also has national standards for state and local planning, and this is really about 15 capabilities, and they are tied to funding. And so really it's this focus on the intersection between public health and emergency preparedness, and really increasing the capabilities of local and state government. Because when there is a disaster, who is the first to respond? Is it FEMA? Is it the governor? No, it is your local emergency preparedness folks. So it's your first responders, it's your health department emergency preparedness group. So we have to build it from the community up. And so here is just that list of the capabilities around public health preparedness for state and local planning. So Homeland Security has a framework from 2013, and it may have been updated since then, for a national response. And it focuses on the work of FEMA, which is the Federal Emergency Management Agency. And there are many many emergency support functions, but within there, health is under the emergency support function number 8. So you can see how FEMA and Homeland Security is framing the functions of health and public health. So this coordinates mechanisms to assist in the response to actual or potential public health and medical disasters. And then this lists the functions. Now, I'm not going to expect you to remember all of these different frameworks, but I'm showing you these different plans and frameworks with their goals and their objectives to just illustrate how complex this whole endeavor is and how many different layers and levels are involved in protecting and mitigating and addressing disasters in the country. So again, we're living in this post 9/11 world, and there's a lot of focus on strengthening and growing the infrastructure and capacity. And one of these really important tools is the National Incident Management System. And I know Mr. Brookman's going to talk about this with you all, because this is a very important aspect of what they do and what they prepare for at the local level. But really, the incident command structure helps to identify the people who are going to be in control. Because with all of these different stakeholders and entities working through a problem, it can very quickly become chaotic and get it's complex, chaotic, and things can get miscommunicated or too many quote-unquote cooks in the kitchen. So this is the structure and the system that is put in place so everybody knows who's in charge. So you have your command staff and then your general staff. And this may look different in different communities, like who fills in these positions, but this is really to help keep things as clear and smooth as possible in times when things are not clear and smooth. So most of us have, if we have interacted with emergency preparedness or emergency systems, it's been the EMS system. So the first medical response is for sudden onset disasters is provided by the local or regional EMS system. And EMS is provided by semi-autonomous local agencies with regional and state oversight. So some of them are typically they're freestanding but associated with the fire department or with the health department, but they work in this kind of semi-autonomous way. And this includes public access systems. So the way many of us have interacted with it was if for some reason we had to call 911. So this also includes the dispatch communication system, and then trained emergency medical responders, which are EMTs and paramedics. They provide transportation and definitive care. So there's specific definitive things that they can provide. So as I mentioned earlier, that public health emergency response resides at the local level and in the local health department. So if that is the city, county, regional, but that local level of public health. Now, when the resources of the local jurisdiction are insufficient to meet the needs resulting from a disaster, local authorities have the option to call for help. And that's really when you hear about the governor declaring a state of emergency, or they may work at a larger regional level to bring in support. One good example of this were the fires that hit Gatlinburg last fall. So firefighters from across the state and even beyond were brought in to help support the local emergency response. And they were able to mobilize in a quick way to respond to this very sudden onset disaster. So the local and state emergency management agencies typically convene a command center away from the disaster site. I went to our regional Tennessee Public Health Association Grand Division meeting last year, and we got to hear from a gentleman who was in that team of leadership for the command center for the Gatlinburg fires, and just the complexity of what they were dealing with a fire such as the fires that were there. It knocked out communication lines, but they had the capacity and have these trucks that provide kind of like a Wi-Fi hub around them, because they're able to bring in internet from, I guess, satellites. I'm probably butchering what they do, but that level of lack of being able to communicate and pull up real-time data on what was happening, if it wasn't for those infrastructure that were already in place, things would have been a lot harder. And so they coordinate these multi-organizational responses, and they spend a lot of time preparing and practicing for disasters so that when one actually happens, all the parties involved can work very closely and do this complex work together. So when we think about preparedness, even though it is locally focused, we do live in a globalized society, and we are impacted by issues and disasters that are outside of our own borders. There are complex humanitarian emergencies that require the work of public health personnel. We have seen this with war, with famine and other natural disasters, and with outbreaks such as Ebola. Just the need and mobilization for the expertise of public health that is beyond what maybe the capacity of the local community. And so these are many of the things that public health personnel do in these humanitarian emergencies that are happening so often globally. So what does this all mean? So there are some common themes that arise around preparedness. The first piece is the prevention. So you want to prevent and mitigate threats and risks. But then when when you just can't prevent all of these things, there's the importance of being able to address them efficiently. The workforce has to be developed. There's lots of trainings. There's volunteer opportunities to be part of local emergency responses. There's this continued need to strengthen the public health infrastructure. Often it's when there's a disaster that we really see the gaps and holes in the system, but we're always trying to identify, prepare, work through as real of scenarios as we can to really understand where the strengths need to be. There's a coordination that has to occur when, again, the local resources and abilities cannot address the issue. Then there's going to be a coordination with others outside of the community. This theme of promoting resiliency, I think, is really important. And then the improvement of surveillance and situational awareness. There's a lot after the terror attacks of September 11th, 2001 around our own abilities to be aware of what's going on, and if something isn't right, letting people know. And then to improve the health systems. So we've seen with Hurricane Katrina, and then we saw some of this come back out with a specific example in Florida of a nursing home where we still need to improve the health systems to be able to address the needs of communities. And we're also seeing this issue with capacity in the health system in Puerto Rico as communities still are not having reliable power. That has a major impact on the hospitals, clinics, individuals who need power for their medication or for the equipment for their health. So that's all I have for you on emergency preparedness or public health preparedness. But I hope you take the time to listen to the other lecture that we will have after Thanksgiving to really get more of that applied hands-on knowledge that we'll get from our guest speaker. Have a great day and have a happy Thanksgiving.